Hi, I'm Kathleen Dollinger, and I am doing my assessment scenario regarding the 38-year-old who was involved in a single motor vehicle collision. I will present the illness, I will give details including past medical history and medications, and I will answer the questions prompted for me on this assignment. Age 38 years old, history of illness, is currently admitted to your floor for 23-hour observation after a single motor vehicle accident in which the patient was unbelted and hit the steering wheel at moderate speed. There were several fractured ribs on the patient's right side, but no other injuries were noted. Upon admission, the charge nurse helps you settle the patient and take care of your orders while you retrieve requested pain medication for your patient. After administration, you return to reassess the patient 45 minutes after administering a pain medication per protocol and note him to be extremely disoriented. After quickly scanning the room and admission orders, you note that the hanging IV fluids and rate are incorrect, which are 0.45% normal saline at 500 per hour. His past medical history is occasional lower back pain controlled with over-the-counter NSAIDs and tension headaches. His medications include pantoprazole 20 milligrams 4 times a day and 0.45% normal saline at 500 per hour at the left antecubital peripheral IV. He also has an order for Percocet, 5 325 milligram tablets, 1 to 2 tablets every 6 hours as needed for pain. When completing this scenario, I need to think of the following questions to help guide my actions. My next action and why. My next action would be to immediately stop the 0.45% normal saline that the patient has hanging that I noticed was incorrect in his room. This medication is a hypotonic solution. Being that the patient was under observation for his single vehicle accident, this makes me wonder if there is any kind of further complications we were not aware of diagnostically. I'm going to be worried about perhaps a bleed. If he did have any kind of head trauma or injury, he may have a brain bleed that we didn't see. If he does take regular over-the-counter NSAIDs for his occasional lower back pain, he may have stomach bleeding or GI bleeding we're not aware of, perhaps an ulcer. Again, if he has tension headaches, it might even be something regarding hypertension or something uncontrolled we're not aware of, which would further exacerbate this. But the biggest thing is stopping this hypotonic solution that I think is increasing his intracranial pressure. Hypotonic solutions tend to cause the fluid to shift from the vascular space of his blood vessels into his interstitial fluid or his cellular space. That's going to definitely increase pressure and volume in areas such as his brain, lungs, and anywhere he might have injury or further bleeding where that fluid's going to go. The next question to answer for my actions is what would I assess and why? I would immediately want to assess his lung sounds. I would want to do a more full neurological assessment. So asking him questions, checking his eyes for pupillary response. I would probably want to sit the head of the bed up at least 45 degrees right now, because if he is having intracranial pressure, I want to try to get some of that pressure off immediately. I would probably want to see if I can have him obey any kind of commands for me, squeeze my fingers, check his response for his strength, and just see what type of level of consciousness this patient has. And I want to be able to include that in my SBAR report, which I would probably want to notify the charge nurse and the current provider immediately. My thoughts on what is happening, I've already kind of answered that a bit. I think that this may be a head injury, but either way, this hypotonic solution is probably increasing his intracranial pressure, which is changing his level in consciousness, causing his extreme disorientation. What do I think got the patient to this point? It was definitely the incorrect medication that was hung. Reading the original paragraph of his illness, it did state that I noticed the fluid was incorrect, 0.45 at 500 per hour. And then reading his medication list, it did match. So it was the same order, 0.45 normal saline at 500 per hour. So the order may have just been put in incorrectly, perhaps. I'm not sure if it was provider or the nurse that decided to hang it. The details don't say that it was, somebody specifically, but that doesn't matter at this point. We just want to stop the medication, notify provider, and get some new orders, because I'm thinking we want to find something to get that fluid off this patient now that we've overhydrated him. Off the top of my head, I know we've learned that mannitol works for pulling power to get some fluid off, and I know we could also administer Lasix. We could even administer a hypertonic solution. So I would want to check with the provider again to see what order he or she preferred. Labs or diagnostic tests I could recommend. If we needed to do some type of MRI or CT so we could see if there is some kind of bleeding, I know we can do an intracranial pressure test with, I believe, a spinal tap. But again, that's going to depend on provider preference. So I think SBAR is going to be the next most important step for me. And then other diagnostics, I'd probably want to just keep a very close watch on his neurological status and his level of consciousness. I would probably want to just keep a very close eye on his vitals, make sure that he's resting so we don't further cause any damage, especially when increased intracranial pressure puts a patient at risk for seizures and other neurological complications. The medications and fluids, as mentioned, were not appropriate. They were incorrect. This patient should have probably been given just an isotonic solution such as normal saline at a pretty slow drip rate, because nothing in his illness presented with any kind of fluid loss, trauma, or bleeding noted that we were aware of. However, I think we should do a further workup just to make sure there's nothing that we missed, especially because he was just in that motor vehicle accident. Sometimes we can not catch things, and that happens. Would I add or remove anything, and why, is my last question. I do think I've already answered that. I want to definitely get some type of hypertonic solution for this patient and possibly some Lasix. And I think with neurological status, regardless of the floor or unit that I'm on, I want to probably keep a very close watch on this patient for assessments maybe every 15, 20, or 30 minutes, just depending on my time management that's needed with my other patients, because again, with intracranial pressure, a lot of things can happen really quickly, and I want to make sure that we get that fluid back off of this patient. It looks like, according to his illness, he's only had that medication hopefully for only the last 45 minutes or hour or so since he did come onto my floor. So I'm hoping that, he's probably only had 500 milliliters, about a half a liter. It's not a lot of fluid, but again, it's something we just want to correct right away. Situation, background assessment, and recommendation for charge nurse as well as the provider would be very important for the details as well. I would want to probably also create an incident report that would not go into the patient's chart, and just make sure that I document everything that I did and the timing, which would be pretty essential for this neurological detail. I do hope that I've answered everything. I know the video did go a bit longer. 3 minutes was required, but I feel like I tried to talk and go as quickly and directly as I could. So thank you so much for watching my illness narrative and assessment scenarios. Have a great day.